it's just a big petri dish.
A Campbell River mom says seeing a video from a youth retreat held at Northgate Church in Courtenay and hearing about the resulting COVID-19 cases is scary.
It's really irresponsible. That's a lot of children in a small place, and the video that's been circling around that keeps getting removed, it's by no means is it, a conference.
One attendee posted this video of the youth retreat that hosted 350 kids from across Vancouver Island. It happened the November 19 to 21st weekend. 5 events were held at the church. Jessica Livingstone finds this part of the video most concerning.
There's no masks, there's no hand washing station, there was no social distancing.
Another mom in Carriade in the Comox Valley says she's been indirectly impacted after there were 15 COVID-19 exposures at her daughter's school, some directly linked to the event.
I've had to keep my children home from school for the last 2 weeks and homeschool them.
Stephanie Hyde says the church should have never held such a large event.
I think it's ignorant, and I think they owe the community an apology.
The church says there was extra cleaning and hand sanitizer was available at the events.
At the time, the public health order was that this would fall under the religious exemption order, which meant that no vaccine mandates were required, that there was no capacity limits. Our team did go over and above in actually letting all the staff, leaders, and kids in attendance know that masks would be mandatory. Obviously, we've seen the pictures and videos to now know that that wasn't followed as we had hoped, and that was disappointing.
The church says it thought it had a good safety plan in place, but if it could do it over and improve it, it would.
There's a lot of disappointment across the valley, and so for any part that Northgate may have played in that, we want you to know we're truly sorry.
In a statement, Island Health says the current daily case counts across the Island Health region cannot be solely attributed to this cluster. These community cases are occurring in a highly vaccinated population, and we are not observing serious health outcomes related to this cluster.